Well, we know that about half of all people with heart failure have a normal ejection fraction. And in contrast to the other half that have the weak hearts, there's no proven pharmacologic treatment. So we're really set out to try to find something to help these people to feel better. So the main thing that the people with heart failure preserved EF or HFpEF, really complain of is exercise intolerance, dyspnea and fatigue. So we wanted to find something that could improve that. So the trial is designed to improve peak exercise capacity, which we measured as peak oxygen consumption during cardiopulmonary testing. The drug that we tested as an intervention to improve this was called inorganic nitrite. And nitrite is actually a chemical in our bodies that's converted back to nitric oxide, preferentially during hypoxia and acidosis, which are conditions during exercise that develop every day. So the idea was this drug could provide more targeted delivery of nitric oxide precisely at the time of greatest need during physical exercise. And we've shown, and others have shown, that this can improve the hemodynamics, lower the cardiac filling pressures and the pulmonary artery pressures, and maybe that'll translate to an improvement in exercise capacity and also quality of life. So we set up the study. It was a crossover design, and patients were randomized to receive nitrite first or placebo first. They received it after a 2-week wash-in period. They received 4 weeks of treatment. They returned and did a cardiopulmonary exercise test and other assessments. Then they crossed over to the other side. So if they got nitrite, then they crossed over to placebo and vice versa. There was a 2-week washout period, so there was no carryover effect. And then we reassessed their exercise capacity a second time with the contrary side of the arm of the randomization. Well, unfortunately, and contrary to our hypothesis, we did not see that nitrite improved peak exercise capacity. And really not much of a signal of benefit in any of the subgroups that we looked at. The secondary endpoints that we looked at included accelerometry, so daily activity levels, based on the idea that maybe if people had better hemodynamics, they would move around more, but we didn't see that. We didn't see an improvement in quality of life assessed by the Kansas City Cardiomyopathy Questionnaire. And we didn't see an improvement in New York Heart Class. So it was quite consistent, unfortunately, across all the secondary endpoints. Nothing seemed to improve with nitrite as compared to placebo, at least in this relatively short 4-week trial. I think it reinforces that we need to work harder and to find an answer, because these people are in urgent need of something that will help them. I don't know if a longer duration of treatment would have been helpful. 4 weeks is a rather short period to improve something like exercise capacity. But it may be that you need to put together some intervention like a drug like nitrite that improves the hemodynamics and couple that with exercise training, because that's the one thing that consistently does improve exercise capacity and quality of life in people with HFpEF. So because the drug works more during exercise, now, in the trial, we encouraged them to be more active and to do exercise, but that's not really the same as providing an actual exercise training intervention. And I think that if we bring those two things together, maybe for a longer duration of time, we'll have better results. And we're actually pursuing that right now in a different trial called ENABLE that we're conducting. That's a single center study that's being conducted where I work at the Mayo Clinic.